Lighting brought to you this morning by the sun. Chronic kidney disease is one of the most common health conditions in cats, especially as they age. You may have seen recently in the media about this new treatment that's being flouted from studies out of Japan. So, what exactly is this treatment and what does it mean for your cat?
Do tell!
We're going to talk about what exactly is CKD, what the latest research is talking about, current therapies for kidney disease, including the importance of diet, and my reflections on this study and what I think the future holds. What exactly is CKD? Chronic kidney disease is defined as a structural or functional impairment of one or both kidneys for more than 3 months. It's detected by elevations in urea and creatinine, so the waste products of metabolism that normally your kidney is responsible for excreting in the urine. So the kidney is obviously an essential organ and has multiple functions in the body other than excreting toxins. pH balance, acid base balance, blood pressure regulation, among other things. When those toxic products build up, it will make the patient nauseous. Other signs you might see in a cat might include excess thirst, because the kidneys are no longer able to retain the water for hydration that they use. Late stages end up in gastrointestinal ulceration, just not eating, vomiting, weight loss, because they're losing protein, excess protein as well. CKD can result from many things, and it is most common in older cats. It will result in an irreversible fibrosis. It's inflammation of the kidney. Unfortunately, with these blood tests, they won't show up until we've lost more than 75% of the function of the kidney. So 75% loss of the nephrons, a little functional unit of the kidney. Once it's detected, it is late stage. We have a staging system in cats called iris staging. So there's 1 to 4, and there's different phosphorus levels that are considered acceptable at the different stages of kidney disease. We'll talk more about treatment later. What are these new studies actually talking about? So there's something known as the apoptosis inhibitor of macrophages. So what does that mean? Apoptosis is the programmed cell destruction. It's actually a normal function in the body to remove abnormal cells. We call it AIM for short, and it's crucially involved in the clearance of intraluminal debris by injured renal tubular epithelial cells. So these are little cells that line the inside of the kidney. There's been a discovery about a genetic variant where cats who have this genetic difference are deficient in AIM. It's often thought that CKD is self-perpetuating disease too, and so having a lack of AIM is actually thought to exacerbate this fibrosis, this inflammation. This regulation of the immune system, that's a protective effect in CKD, is deficient in some cats and therefore associated with a decline in kidney function. So this is huge. This is a big discovery. What one of these studies is talking about is moving on to the next stage of clinical trials for an injection that will replace this deficient AIM. And then they're saying they'll have that out in 2027. So what are my thoughts on that? Stay tuned to the rest of the video to see at the end. As this is such a common issue and such a poorly managed condition, especially in cats, like we don't have dialysis like we do in people, so we can't replace the filtrate, like remove the toxin properly. What current therapies do we have for such an important illness in cats? Actually, the mainstay is still diet. These special kidney diets have a lower protein and salt concentration, so basically it's helping the kidney not work as hard. This is my opinion, by the way, so you should definitely seek your vet's advice on your own cat specific situation. You can look up the IRIS guidelines for the therapy, and it will talk about other supportive care, fluid therapy, and appetite stimulants, anti-nausea medication, and phosphorus binders. So basically the phosphorus level will build up as the disease progresses and the kidney's no longer excreting that mineral. You might have seen the controversy around diets. And so traditionally, cats are fed a dry food diet, and there are problems with this. They are obligate carnivores. They're not designed to eat such a high carbohydrate diet. However, the kidney diet was the first ever prescription diet created back in the 60s, and it was revolutionary, saving lives. And it's still used to this day. And so, this is why vets are big proponents of those big pet food companies, because we have seen some life-changing improvements in our cases. And there's obviously a lot of other prescription diets for different diseases that we won't go into at this time. A lot of people are talking about raw diets and things like that, meant to more closely mimic the cat's natural diet, which was rodents. So they would hunt and catch rats. This is very different to getting some raw mince handed to them on a plate that's been sitting in the supermarket for who knows how long. Problem with raw meat, why a lot of humans can't eat a lot of different meats such as chicken, especially in pork, is because of the high levels of pathogenic bacteria. Things like Salmonella, Campylobacteria can make you really sick. Especially mince, it's got this high surface area, so the bacteria, there's a lot more exposure to oxygen and room for them to grow in massive numbers. I'm a big proponent of the wet food diet. Obviously, some dry food in there is fine, and it is way more economical, and that is probably why most people feed that. Importantly, for some cats, they do have that preference. This is where it's really important when they're a kitten to expose them to a lot of different diets. So cooked chicken, pieces of meat, like you could probably safely feed raw beef, rare beef, like it's like humans can eat rare beef. Cats have less taste buds than people, so they're much more fussy. And if they're not exposed to that food when they're in their younger years, kittenhood, they often won't touch it. They don't understand. They don't know what it is. The cat's descended from desert animals, and that is why they're actually not particularly good at being water drinkers. We need to give them more options. Don't have their water in one of those dual bowls where it's right next to their food. Biologically, they think this water is contaminated. It's like an inbuilt safety mechanism. They know what's good for them. They want fresh running water. So, does your cat ever drink out of the shower or the bathroom tap? Get them a water fountain. Also, some cats don't like the too much running water. They want more of the still water, but it's got to be fresh, filled to the brim. Try different options like stainless steel, even a dog's bowl. It's big, wide, their whiskers aren't going to touch it. Glass bowls. So cats like to have choice, just like us. The ultimate cat bowl cleaner is your dog. The face of innocence. There is a serious lack of evidence generally for cats. Unfortunately, they're not the type of animal that makes a whole lot of money, and ethically humans are preference. Dogs are a little bit further ahead than cats, but they're still certainly behind the human health world. So there are actually other studies going on too. I'll link them here. So there's one supplement called AB070597. It contains a complex of amino acids, which is a secret sauce. Again, poorly understood due to lack of studies, and it's likely that one of the amino acids it contains is arginine. Arginine is thought to reduce kidney damage by reducing that inflammation. In addition to being behind in general about health conditions, there aren't enough studies done on dietary management because there isn't as much money to be made from these studies. Drug companies want to invest in something that they can market, they can sell and make a profit from. So this supplement, they've acknowledged themselves that it was a small study. So it's less applicable to the general population. You also do need to look at things geographical difference. So we do have differences in diet, lifestyle, other disease prevalence. It's a very complicated disease, CKD, and so there's still a long way to go. It is exciting to think that there is a potential cure coming. Just do look at it from a critical perspective. We need to make sure that those studies that come out by 2027 are high quality studies. So we do practice evidence-based medicine. We don't want to be recommending products, spending hard-earned money on something that's not going to make a difference in your cat's life. Talking about diet, there's a lot of misinformation out there. There is a lot of money to be made from the pet industry. Vets actually, there's no sponsorship from big pet food companies. We feed these products to our own pets because we believe in it. And most people buy things online these days. We don't actually get like a direct profit. We just want what's best for your cat. And this is shown by, so one of the biggest cat journals in the world is the Journal of Feline Medicine and Surgery. It's now open access as of a couple of years ago. It is completely free. That is because they want cats to have the best chance of the best health possible. So making sure everyone across the world, even in developing countries that have less quality healthcare, that cats can access, the best healthcare. Look at what happened with COVID and the way when everyone works together, everyone gets the best outcome. One of the best things you can do in addition to feeding, high moisture content diet is the regular health check. So getting your pet checked at least 6 monthly when they're over the age of 10, they're a mature pet and they become geriatric and they're much more likely to get these diseases. And so we're not just making money by wanting to do all these tests. This is picking up the illnesses before it's too late. While we can't cure CKD at the moment and maybe not ever in the future, there will be improvements made. And the earlier you pick this up, the earlier you can get them onto the diet and be really considerate of water. There's other tests you can do. Once you know they have the CKD diagnosis, you can be doing other extra tests to look at their protein levels, and there's medication for that now, and there's a cat specific medication because we all know how hard cats are to medicate. Basically, it's a watch this space. Have your critical hat on when you're looking at any of these news stories, and if in doubt, speak to your vet. Do you want to know more about health in cats? So what are the most common diseases in cats? So check out my video about that.